Welcome back to Jersey Matters. I'm Larry Mendte. Seniors, especially seniors with medical conditions, are at the front of the line to get the COVID-19 vaccine in New Jersey. But what if they can't make it out of the house to get to the line? Dr. Steve Landers is the CEO of the Visiting Nurses Association, and he says that's one of the biggest problems with vaccine distribution in New Jersey. Doctor, thanks so much for your time. Can you explain how your organization is involved in the distribution of the vaccines?
Sure, absolutely. So we're a Visiting Nurse Association health group. We provide home and community-based services throughout New Jersey, and we have a special focus on community health services in central New Jersey, Monmouth County in particular. And through our partnering community health centers in Monmouth County, we are in the service of providing community vaccination. And also we're very focused on making sure our employees and our home care workers are vaccinated as well. So we've been looking at vaccination on several different fronts.
So you hear from ground level about potential problems with the vaccination and the distribution of the vaccination. What are you hearing?
Well, it's starting to get better week by week, but out of the gate, there was a lot of uncertainty about how much supply you'd be getting, and that makes it hard to know how many people to schedule, how much staff to have. But day by day, everybody's working really hard to make that more effective.
Are you having any problem with surplus vaccines? I know that's been a problem in some states where they've actually had to get rid of vaccines. Has that been a problem in New Jersey that you've seen so far?
No, we've been able to use the vaccine that we're being provided, and we're hoping for more.
What problems are you seeing?
Well, I think that, some of the problems are making sure that older people and people with mobility challenges are able to get access to the vaccine. Some of the registration systems we're using are online, and so we have to think about other ways of community outreach that will get more vulnerable groups. And I think that's something that we're focused on. Also, there's been some vaccine hesitancy among certain groups, and we want to make sure that people that are in most need and at risk get access to the vaccine.
Let's go through group by group, because I think I know who you're talking about, but start with the one that you mentioned specifically. Seniors. I would think that the vast majority of seniors want the vaccine. The problem that seniors will have is getting the vaccine. Should the state be doing a better job, and I'm not just talking about New Jersey, but all states, should they be doing a better job of outreach, of getting out, either transporting seniors to the vaccine or bringing the vaccine to them?
I think with respect to bringing the vaccine out to seniors, particularly what we call homebound or low mobility seniors, we need to do more. And actually, I've been personally reaching out to officials at Medicare and folks in the federal government to try and pay more attention to their policies related to vaccination of homebound seniors. There's over 2 million people, older adults in the United States, who are deemed to be mostly or completely homebound. And I've done thousands of home visits to homebound folks, and a lot of them are just not going to be able to get out of their house to vaccine centers. And we need more attention focused on these very low mobility seniors. Then there are other seniors who likely can come to clinics and other vaccination sites, but we have to up our game with respect to outreach for those that might not be as nimble with the online registration protocols.
I don't know what the numbers are specifically in New Jersey, but across the country, they talk about a 10% rate of no-shows. And since seniors are among the early people getting vaccines, many of them are seniors, and many of them just can't figure out a way, as you talked about, of getting there. Has that issue been dealt with?
Yeah, I think that families are stepping up, and I've seen community agencies try to find ways to offer transportation. But that's going to get the people that can get out. Otherwise, we're going to have to get into people's homes and assisted livings and independent livings. I think more thought and energy needs to be on how do we make sure there's access for seniors? It's a big area of need, and of course, seniors, older folks are at very high risk from mortality and complications from COVID-19. So this should be of very high priority.
The rate of COVID in the communities of color has also been very high, and it seems like there needs to be outreach there too for a completely different problem. You alluded to it a moment ago. Some people just don't trust this vaccine.
No question. There are some issues around vaccine hesitancy or mistrust, if you will, particularly in some subpopulations, communities of color. Another group who seem to be at higher risk for mortality and complications. So they really do, need to get access to vaccine to save lives and protect people. So, I've been on a number of calls and efforts around outreach to communities with high populations of people of color. We've been trying to connect with some in the faith community to try and reach out to their pastors and other community organizations that might have a good level of trust in order to drive adoption of vaccination. I can't say I know that we're making progress just yet, but I know that that's been a hot topic and an area of focus.
We've only been talking about problems. Let's end on a positive note. Overall, would you say things are going well right now?
Day by day, I'd say they're getting better. So I think this was, out of the gate, really rough in terms of the logistics of all this. It's getting better day by day. I'm not ready to give us an A grade yet, especially until I see better policies focused on homebound seniors and the most vulnerable.
Thank you so much. I appreciate your time, Doctor.
Dr. Steve Landers, CEO of the Visiting Nurses Association. Still to come on Jersey Matters. Are you looking for a new friend during the pandemic? We have a couple suggestions. We'll introduce you to them next.